So full mouth reconstruction is indicated in situations where the teeth are worn, broken, missing, if they are deteriorated badly enough that we basically need to rebuild every tooth. Sometimes we can get away with just doing a full reconstruction on the upper teeth or just the lower teeth. But the typical situations where it's needed are if you have a situation where your teeth have worn or you've lost enough teeth that your lower jaw is closing more than it should, and we need to open your bite back up a little bit. So if your teeth have worn where they're so short that your chin is coming up too far, we might need to make your teeth a little bit longer. And that's really frequently the case with people with a lot of missing teeth, particularly if you're missing your molars and you don't have back teeth. You might have spent decades putting too much force on your front teeth, and those front teeth can flare out, they can wear down, those sorts of things. The main candidates for full mouth reconstruction are the people who have lost the vertical height of their teeth and then therefore their jaw because of extensive wear, missing teeth, cavities, gum disease, those sorts of things.